Good evening, this is All India Radio Kohima and I am Nobin Pradhan with the evening news. The headlines. Centre asks states, union and territories to take up coronavirus testing of grocery shop workers, vegetable and other vendors. Dimapur and Kohima districts fix rate for paid quarantine facility. Nagaland reports 31 fresh COVID-19 positive cases, taking the state total to 2,688, and Health and Family Welfare Department issues guidelines on rational use of COVID-19. The details. The Health Ministry has asked states and union territories to take up coronavirus testing of grocery shop workers, vegetable and other vendors. It stated that if undetected, grocery workers can potentially spread the infection to a large number of people. In a letter to states and UTs, Secretary Ministry of Health Rajesh Bhushan also stressed the need for operationalizing ambulance transport system with oxygen facility and quick response mechanism. He underlined that refusal rate of ambulances must be monitored at a daily basis and brought down to zero. With the pandemic now spreading to newer areas in the country, Bhushan said there are likely to be scattered cases, cluster of cases, or large outbreaks in districts. He said the primary aim is to control outbreaks, especially in new locations, and to save lives at all costs. He said the aim should be to further reduce mortality and ensure that it does not cross the 1% mark. The Secretary pointed out that early detection of cases through aggressive testing, prompt isolation or admission in a healthcare facility, and ensuring proper clinical management are major components of mortality reduction. He stressed on enhanced surveillance for influenza-like illness and severe acute respiratory illness, as the symptoms are mostly the same as COVID. He also asked the states and UTs to undertake weekly death audits to assess the determinants of death such as age differentials, comorbidities, late reporting to hospital and clinical protocols that were followed. In the letter, Bhushan also said that a regular house-to-house search must be done periodically to identify those who are at high risks. Dimapur District Task Force DTF has informed that the quarantinees will be charged for food provided at the respective quarantine centres with effect from August 10 as per government order. Dimapur Deputy Commissioner Rajesh Rajan informed that the DTF has fixed 350 rupees per person per day at institutional quarantine, which includes breakfast, lunch, dinner and water, and for logistic expenses. Payment to the caterers will be done on daily basis, and officials in charge or managers of quarantine centers will collect the amount from quarantinees and deposit the amount to the caterers. Quarantinees may opt to arrange own food from outside the quarantine centers, for which the food should be packed in a single-use disposable containers of biodegradable material. The DC said quarantinees will get release slips from the QC only after clearance of the food bill. Meanwhile, the DC observed that some colonies and wards are obstructing entry and exit of health workers and frontline workers from their wards and colonies for performing duties. In this regard, the DC cautioned that issuing unwarranted directives which infringe on individual rights and in violation of government orders will be liable to be punished. Kohima District Task Force DTF on COVID-19 in its meeting decided that paid facility at K. Badze Quarantine Center will be implemented from the 10th of this month at the rate of 300 rupees per day for lunch and dinner. The DTF meeting held yesterday decided that other basic requirements will be made available on payment. All the charges incurred by the returnees at the quarantine center should be cleared before discharge from the quarantine center. DTF decided to propose installation of true net machines in all 4 blocks of Kohima district comprising Tsemenyu, Chipobozu, Secha Zubza and at TB Hospital. The DTF also discussed measures to check wearing of masks and other safety protocols, including waste management. Evaluating the 14 days lockdown which ended yesterday, the DTF felt that the lockdown period has facilitated the medical team in conducting contact tracing and surveillance activities, which enabled them to handle the tasks in more efficient and better manner. Medical doctors participating in the DTF meeting agreed that the lockdown reduced the chain of local transmission among the public and the number of testing outside the QCs became less, which ultimately resulted in less positive cases, COVID hospital and COVID care center. Nagaland reported 31 COVID-19 positive cases today out of 600 samples sent for testing. Health and Family Welfare Minister S. Pangnyuphom in a tweet today informed that 12 of the cases are reported from Kohima, 10 from Dimapur, 6 from Zunheboto and 3 from Wokha. Out of the 31 new cases, 11 are from the armed forces, 5 from inbound travelers, 10 from contact tracing, 4 from frontline workers and 1 other case. The total positive case in the state has risen to 2,688. You are listening to the news from All India Radio, Kohima. Health and Family Welfare Department has issued guidelines on rational use of COVID-19. As per the guidelines, the testing criteria shall be in conformity with ICMR and state SOP. Priority for testing will be given to high-risk contacts or symptomatic cases. All other cases, including low-risk contacts, shall apply for slot for sampling and testing to the district health authority through phone, WhatsApp or email. Type of testing to be done shall be decided by the attending health personnel and no person shall demand the type of testing. Test results will be provided depending on the caseload of the testing lab. No person shall insist on retest if the test result is truly positive by rapid antigen test or truly negative by TrueNat. The Health and Family Welfare Ministry today said over 14,27,000 people have recovered from coronavirus infection in the country so far. The recovery rate has gone up to 68.32%. The ministry said a total of 61,537 new cases of COVID-19 were reported in the country in the past 24 hours, taking the total number of cases to 20,88,612. Presently, the total number of active corona cases in the country is 6,19,088. In a single day, 933 deaths were reported, taking the nationwide toll to 42,518. According to the Indian Council of Medical Research, as many as 5,98,778 samples were tested yesterday, taking the total to 2,33,87,171 so far. And in some good news, a 93-year-old man, probably the oldest COVID patient in the state, and his 79-year-old wife, also a COVID patient from Phek district, have tested negative for the virus today. Nodal Officer of Integrated Disease Surveillance Program informed that both have recovered from the infection and were discharged today in presence of Phek Deputy Commissioner and SP at the district hospital. Deputy Commissioner Dimapur Rajesh Rajan, after assuming the office, chaired the first Dimapur Task Force meeting yesterday at DC's conference hall. The Deputy Commissioner called upon the members to avoid unnecessary panic and asked them to take all required precautionary measures against the pandemic. He also advised them to sensitize the people so that issues of stigma and discrimination are avoided. Rajan asserted that calibrated reopening of markets will be chalked out in the local context. Nagaland's School Education Department today informed that video lessons telecast by the department through Doordarshan, YouTube and Facebook will be available at GeoTV under the channel name School Education Nagaland from next Monday onwards. Principal Director Shanavas in a notification advised interested teachers and parents to encourage students to make use of the telecast so as to enhance their learning experiences during the period of closure of schools caused due to the COVID-19 lockdown. And to end the news, a reminder of the headlines. Centre asks states and union territories to take up coronavirus testing of grocery shop workers, vegetable and other vendors. Dimapur and Kohima districts fix rate for paid quarantine facility. Nagaland reports 31 fresh COVID-19 positive cases, taking the state total to 2,688, and Health and Family Welfare Department issues guidelines on rational use of COVID-19. And that's all the news we have for you this evening. Good night.